So I'd like to move on to the next question. As you know, there's a lot of skepticism and myths related to this vaccine that's likely contributing to some of the hesitancy of taking this vaccine. So for each panelist, what doubts did you have initially and what changed your position in getting vaccinated? And we can start off with Caroline.
Okay. So for me, the first question I had is whether or not it would be safe for me and the baby to be receiving this vaccine, just because there's not a lot of research out there. So we I pretty much did all the research that I could and got a lot of information from the hospital itself about what's the recommendation, and kind of decided that the benefits outweighed the risks, although they have not seen much of any risks with pregnant women so far. I just got from Dr. Bruno Murtha a new study that came out that says that the new research says that 78% of the babies they were born with women that had antibodies on their system. The babies will also had the immunity. So it's kind of exciting to me to know that there's a chance that my baby will be immune, especially for a few months in the beginning when they're newborn and they're more at risk, knowing that they'll be hopefully safer than they would be otherwise, seeing other people and being, coming into the hospital for appointments. So that's a really good thing that I learned. The other thing as well is I've heard that people have been talking about the vaccine not being safe for a pregnant woman, that it can cause abortion, and that is a myth. So I'm glad that I never came across that myself, and that was not one of the reasons why I didn't do it, but I really want people to know that it's not the case. There's no research that shows that women can get miscarriage after getting the vaccine, but they can get much sicker if they do get COVID. So that's why I decided that it was a way better chance for me to get the vaccine than, to get COVID itself.
Thank you. David, would you like to go next?
Yes. So I did have a lot of doubts in the beginning. Like I said, I am Brazilian. I am around Brazilians all the time, and it's very common on WhatsApp. We receive videos of some guy saying things that gives you like a little doubt. And I remember that one of the things that they were talking about in a bunch of videos that I received was that the vaccine could change your DNA. Mm-hmm. It could, if you didn't have kids yet, your kids could, be born with some defects and this and that. And that was a little scary because I didn't know much about the vaccine. The other thing that I heard too was that it is impossible to a good vaccine to be ready in 1 year. That was very strong points that made me have doubts, have a little doubt about the vaccine. And also the president of Brazil, he thinks the same thing, the same way the former president of the United States thinks that the COVID is just a little cold and you are okay, you're gonna be fine. And you always think that a very powerful man saying those things, he probably has information that we don't. Mm-hmm. So that gives you like a little cold feet, like you don't know if that's really safe. So that was the reasons why I was a little doubtful in the beginning. And that what made me change my mind was education. I read about it and I learned. And the other side too was fear. Seeing my colleague losing 3 brothers made me realize that this is real, and that's why I changed my mind and I got vaccinated.
Thank you, David. Sovali, would you like to go next?
Yes. Yes, I had some initial doubts about the vaccine. However, those doubts was not so much on the quality of or the efficacy of the health community, but more on the historical, cultural, and racial prejudice of institutions using Black and Brown communities as test subjects without their consent. And in some cases, to use them in adverse ways under the ploy of health and safety measures. In addition, I was questioning the short period for the vaccine to be available, especially since it is said that it takes years for a vaccine to be developed, approved, and available to the public. However, I agree with the fact that due to the emergent situation, the government created avenues to make the vaccine available in a short period.
Thank you, Solvali.